Did you know that a common vitamin, something many seniors take every single night, could actually increase your risk of stroke overnight? This may sound unbelievable, but new medical research shows that when this vitamin is taken the wrong way, it can quickly turn from healthy to harmful. I'll never forget one of my patients, a 70-year-old man who thought he was doing the right thing by taking his supplements every evening before bed. One night, he didn't wake up feeling stronger. Instead, he woke up in the hospital after suffering a sudden stroke. His family was shocked because they thought vitamins were always safe. The truth is, in excess or at the wrong time, even vitamins can become dangerous. Here's a fact you should know. According to the World Health Organization, nearly 1 in 4 strokes worldwide are connected to lifestyle and preventable factors, including diet and supplements. And the vitamin we'll be talking about today has been shown in multiple studies to increase the risk of bleeding and clotting problems, especially in adults over 60. That's why you need to know the warning signs and the safe alternatives. Before we dive in, make sure you subscribe to Health Bloom Guide and tap that notification bell so you don't miss any of our life-saving health updates. Go ahead and like this video, share it with your family and friends, and in the comments below, tell us your location. We'd love to know where you're watching from. Now, let's uncover which vitamin could be silently raising your stroke risk. And, more importantly, what natural foods can keep you safe, strong, and healthy. Not long ago, I treated a 68-year-old man who truly believed he was taking the right steps for his health. Every night, he swallowed large doses of vitamin D pills, convinced they were protecting his bones and keeping him strong. But one night, everything changed. He collapsed suddenly, rushed to the hospital, and doctors discovered he had suffered a massive stroke. His family was shocked. How could something as simple as a vitamin cause such a devastating event? The truth is this: vitamin D is essential for strong bones, but in large amounts it can do more harm than good. When seniors take too much, vitamin D pushes calcium into the blood. Instead of going into the bones, that extra calcium can build up in the arteries. Over time, the arteries stiffen and narrow, like a pipe slowly clogging. This increases the chance of blood clots, which can block blood flow to the brain and trigger a stroke. Here's a fact you should know. According to the National Institutes of Health, the safe daily dose for most older adults is only 600 to 800 IU of vitamin D. But many seniors unknowingly take 5 to 10 times that amount, especially with high-dose supplements. Research has linked these extreme doses to higher risks of heart disease, kidney problems, and yes, even strokes. I've seen more than one senior come into the clinic complaining of dizziness, headaches, or unusual weakness, only to find out they were taking too much vitamin D. They thought they were helping their bodies, but instead they were putting themselves at serious risk. It's a reminder that even something natural can turn dangerous when misused. So here's my warning to you. More is not always better. Don't take mega doses of vitamin D without medical advice. Get your levels checked, follow safe guidelines, and whenever possible, choose natural sources like sunlight, fish, and leafy greens. Your health and safety depend on balance, not excess. Now, while vitamin D can be risky in high amounts, it's not the only vitamin you need to watch out for. Let's look at the next one. a supplement many people believe. Mary, a 72-year-old grandmother, wanted to keep her heart healthy. She read online that vitamin E could protect the arteries and thin the blood. So every morning, she swallowed a high-dose capsule, proud she was doing something good for her health. But one morning, while playing with her grandchildren, she suddenly collapsed. At the hospital, doctors discovered she hadn't suffered a blockage, but a bleeding stroke. The very vitamin she thought was protecting her heart had put her life in danger. You see, vitamin E does something important. It makes blood less likely to clot. In small amounts, that can be helpful. But in high doses, the blood can become too thin. For seniors, whose blood vessels may already be fragile, this means a higher chance of internal bleeding. When a small vessel in the brain bursts, it spills blood into the surrounding tissue. That's what we call a hemorrhagic stroke, a bleeding stroke. And it can be just as deadly, if not more so, than a clot-related stroke. Here's what the science says. The recommended daily allowance of vitamin E for adults is only 15 milligrams, or about 22 international units. But many supplements on the market contain 400 IU or more, nearly 20 times the safe limit. According to research published in the Journal of the American Medical Association, high doses of vitamin E not only fail to extend life, they actually increase the risk of hemorrhagic stroke by up to 22%. I remember another patient who complained of frequent dizziness and sudden nosebleeds. He thought it was just old age catching up. But when we looked closer, we found he was taking 2 high-dose vitamin E capsules daily. His blood was so thin that even a minor fall could have caused life-threatening bleeding. These are the silent warning signs that many seniors ignore, until it's too late. So here's the bottom line. More vitamin E is not better. In fact, too much can turn deadly. Don't assume that a pill promising heart health is always safe. If you're already on blood thinners like aspirin or warfarin, taking extra vitamin E can multiply your risk of brain bleeding. Instead, get your vitamin E the natural way from foods like nuts, seeds, and green vegetables. That way, your body gets what it needs without tipping into danger. Vitamin E isn't the only supplement with hidden risks. Let's move to the next one. A vitamin many seniors take for energy, but which can quietly strain the heart. Margaret, a 74-year-old retired teacher, thought she was taking care of her health. Every morning, she swallowed high doses of vitamin B6 supplements, believing they would keep her nerves strong and her memory sharp. But over time, she noticed her hands trembling and her feet going numb. One afternoon, she collapsed from sudden dizziness, and the diagnosis shocked her family. She had suffered a stroke. The very vitamin she trusted to protect her nervous system had quietly damaged it. Here's the truth. Vitamin B6, or pyridoxine, is essential for nerve health in small amounts. But in high doses, it does the opposite. Instead of nourishing the nerves, it can damage them, leading to tingling, numbness, and poor coordination. Seniors with damaged nerves are more likely to stumble or fall. And if the damage affects the way blood vessels and the brain communicate, the risk of stroke rises. Think of it like an electrical wire. Too much current can fry the system instead of powering it. Here's a fact. The recommended daily allowance of vitamin B6 for older adults is only 1.5 to 2 milligrams. But many supplements sold today contain 100 to 500 milligrams per pill, hundreds of times the safe amount. According to the European Food Safety Authority, chronic high intake of vitamin B6 is directly linked to nerve toxicity. And studies suggest that seniors with long-term nerve damage face a much higher risk of losing balance, falling, and suffering stroke-related complications. I recall a patient who came to the clinic saying, "Doctor, I can't feel my fingertips anymore." He thought it was arthritis, but in reality, his nerves were shutting down from excess vitamin B6. His balance was so poor that even a short walk across the living room became dangerous. These are the subtle signs: tingling, numbness, loss of balance, that should never be ignored. So here's the warning. More B6 is not better. In fact, too much can cause the very nerve damage it's supposed to prevent, raising your risk of falls and stroke. Seniors should avoid high-dose B6 supplements unless prescribed, and instead get this vitamin naturally from foods like bananas, poultry, and potatoes. But B6 is not the only vitamin with a dark side. Another common one, found in cod liver oil and many supplements, can turn toxic in high amounts, leading to dizziness, fainting, and even collapse. Let's talk about vitamin A. George, a 70-year-old grandfather, had been taking cod liver oil for years. He believed it was the secret to strong eyesight and a healthy immune system. But one evening, he suddenly felt dizzy, lost his balance, and collapsed. At the hospital, doctors found he had dangerously high levels of vitamin A in his blood. That excess had weakened his system and left him vulnerable to a stroke. Vitamin A is vital for vision and immunity, but it's a fat-soluble vitamin, which means the body stores it instead of flushing it out. Too much builds up in the liver and bloodstream. When levels climb too high, it causes toxicity. Symptoms include dizziness, blurred vision, headaches, and in severe cases, collapse. For seniors, this stress on the body can push the brain and blood vessels over the edge, increasing stroke risk. Here's a fact. The safe daily allowance of vitamin A is just 700 to 900 micrograms RA. But cod liver oil and some supplements can contain 3,000 micrograms or more in a single dose, well above the toxic level. The World Health Organization warns that chronic vitamin A toxicity can cause liver damage, bone weakness, and increased risk of hemorrhagic events like stroke. Yet many seniors continue taking these high doses, thinking they are safe. I once treated a woman who said she felt constantly lightheaded, like the room was spinning. She thought it was just aging, but her blood tests showed extremely high vitamin A levels from daily cod liver oil. Her collapse one evening was the body's final alarm. Symptoms like dizziness, nausea, blurred vision, or sudden weakness can all point to vitamin A overload. So here's the truth. Too much vitamin A can poison the body slowly and silently. It's not just about weak bones or nausea. It can set the stage for stroke and permanent damage. Don't take cod liver oil or high-dose vitamin A supplements unless directed by a doctor. Instead, rely on natural sources like carrots, spinach, and sweet potatoes. Nature provides what you need, without the danger of toxic overload. Remember, balance is everything. Even essential vitamins can become dangerous when taken in excess. Protect yourself, stay informed, and always choose health with wisdom. Henry, a 72-year-old grandfather, started taking large doses of niacin, or vitamin B3, after reading online that it could cleanse his arteries. At first, he felt energized, believing he had discovered a natural secret for heart health. But one afternoon while gardening, Henry suddenly grew dizzy, his vision blurred, and he collapsed to the ground. His wife rushed him to the hospital. The doctors said his blood pressure had dropped dangerously low. The very vitamin he trusted had put him at risk of stroke. Vitamin B3, also known as niacin, is important in small doses. It helps the body turn food into energy and supports healthy cholesterol. But in large amounts, often the same high doses found in artery cleansing supplements, niacin forces blood vessels to expand, lowering blood pressure. For a senior, sudden drops in blood pressure can reduce blood flow to the brain. This means less oxygen, more dizziness, fainting, and in some cases, stroke. Imagine your brain as a lamp. It needs steady electricity to shine. Too much niacin cuts that current, dimming the brain and making a collapse more likely. Here's the truth. While the daily recommended allowance for seniors is just 14 to 16 milligrams, some supplements advertise mega doses of 500 to 1,000 milligrams per pill, more than 60 times the safe amount. The American Heart Association warns that although niacin can help lower cholesterol, in excess it causes dangerous side effects: flushing, dizziness, liver damage, and worst of all, a higher risk of stroke from extreme blood pressure drops. Too much niacin is not just uncomfortable, it's dangerous. Seniors who take high-dose niacin without medical supervision may unknowingly put themselves at risk for fainting, falls, and even stroke. Remember, natural doesn't always mean safe. Niacin should only be taken in high doses if prescribed and monitored by a doctor. Otherwise, the safest way to support your heart and arteries is with a balanced diet, regular exercise, and proper medication when needed. So here's the lesson. Even vitamins can turn harmful in excess. Protect your brain, protect your heart, and never take high-dose niacin unless your doctor tells you to. Now I'd love to hear from you. Are you currently taking any vitamin supplements? Type 1 for yes and 0 for no in the comments. And let us know where you're watching from. If you found this video helpful, don't forget to like, share, and subscribe. It helps more seniors stay safe and healthy. And remember, your health is your greatest wealth.